Hey everybody, it's Dr. Lindsay Ogle, board certified family medicine and obesity medicine physician, and I am so excited to talk to you today about lifestyle recommendations for patients with type 2 diabetes. So I'm specifically talking to patients that have type 2 diabetes, but in reality, these recommendations are helpful for us all. So everybody can learn something here and can take away a couple of key points to improve our metabolic health and either help manage our diabetes or help prevent the development of diabetes in the future. In this video, I'm going to talk about 5 lifestyle recommendations that will help improve metabolic health, help prevent diabetes, and help control diabetes if we have it. So the first one is actually to go to your doctor and be screened for diabetes. It is important to know what your numbers are. Do you know what your fasting blood sugar is or what your A1C is? Do you know if you even have diabetes? There are millions of Americans who have type 2 diabetes and have no idea. And this is so devastating because diabetes is going on and they may not even have any symptoms, but it's putting them at risk for complications like heart disease, stroke, nerve damage, poor wound healing that can lead to amputations, vision changes and blindness, chronic kidney disease, which may ultimately lead to dialysis. These very significant and severe complications could be progressing towards that and they have no idea. So go to your doctor, make that appointment, get your blood levels checked, blood sugar checked, your A1C, and know where you stand. The cutoffs for diabetes for a fasting blood sugar is 126 or above. Pre-diabetes is between 100 and 125, and then anything less than 100 is considered normal. An A1C of 6.5 or above is considered diabetes, and an A1C between 5.7 and 6.4 is prediabetes, and then 5.6 or below for an A1C is in the normal range. Typically for patients who have type 2 diabetes, their goal A1C is 7 or below. But many of my patients, through either medications or lifestyle or a combination of the two, they are able to get their A1C into either a prediabetes or a normal A1C range. And so it is possible to control your diabetes, but you need to know where you stand now and along the way. A1C levels we usually check every 3 months or so, just because on how the lab itself works, because it's looking back at an average of your blood sugar over the past 3 months. So you usually get this every 3 to 6 months, depending on what your numbers are. Lifestyle recommendation number 2 for diabetes management and prevention is to decrease your intake of added sugar. Now, this may seem really basic and for some people obvious, but a lot of people are not doing it because it can be really easy to get into a habit of eating and drinking certain things that have a lot of sugar, and we just really don't think about it. So I highly recommend that you start looking at labels, and there's a law now that any food or drink that has a label on it needs to report how much added sugar it has. So it's very easy to identify when certain foods and drinks have an excessive amount of added sugar. Ideally, you're looking for items that have 0 added sugar, but of course there sometimes will be added sugars and that's okay. But the lower the number, the better. It's so important to look at this because there are certain items and brands really that are kind of created and marketed as healthy foods and healthy options, but they really sneak in a lot of added sugar to make it tasty and make people want to continue to buy those products. So look at those labels, and you may be surprised on how much added sugar is in some of the items that you're eating and drinking now. Lifestyle tip number 3 is actually to increase the amount of protein and fiber that you are eating. And it's always nice psychologically when you are adding something rather than taking it away. And that's why I really like this recommendation to add more protein, add more fiber. And I don't know if it's just me, but my social media, my Instagram feed has a lot of dietitians and health experts, influencers, and doctors talking about high protein and high fiber diets. And there's really a reason. It's because these are really healthy and helpful diets to follow. And so I really echo those recommendations to increase the protein and increase the fiber. The reason being is that both fiber and protein is going to increase your sensation of fullness. And so the more you eat of them, the less you will eat overall. They're both really important macronutrients for your overall health. Protein is the building blocks for really everything in our body, our muscles, our heart, all of our organs, as well as the enzymes that are used to run our bodily functions. And then the fiber is what really helps us to have a healthy gut microbiome and to have regular bowel movements. It's been associated with decreased risks of cardiovascular disease and certain cancers like colon cancer. So definitely increase that protein and fiber intake in your diet. And I will have additional videos and content in the future that will talk about exactly how to do that. And a little bonus recommendation is to eat your protein and fiber first in your meal. So if you're gonna have carbohydrates or sugars, that's totally fine. But often from a metabolic health standpoint, if you eat protein and fiber or protein or fiber before the carbohydrates, you're going to have a more steady blood sugar during and after that meal than if you were to eat the carbohydrates before the protein and or fiber. So a quick bonus tip there to help improve your metabolic health and improve your blood sugar levels. Tip number 4 is another one that's probably not a surprise, but it's to move more. And I'm not just talking about dedicated physical activity or exercise, just moving around the house more. You can do this by when you're on the phone, walking around kind of in circles in your home. If you have a work meeting that maybe you don't have to sit on the video for, you can also walk around. Standing desks, I'm actually standing at a desk right now, gives you additional benefits more than sitting. Walking pads for desks are very popular right now, and that's a great way to get some steps in. Walking counts as exercise, so don't let anybody tell you that walking is not exercise. It absolutely is, and it's a really great way to get your body moving, blood flowing, and get your blood sugar levels lower. Another bonus tip is to have your movement or do your physical activity, whether that's the walk or the cleaning of the house, or playing your sport, to do that after your meals. And that's going to have that additional benefit of lowering the blood sugar that tends to be highest after meals. If you are active during that time, then that's going to really help lower and even out your blood sugar levels. The last tip is probably the hardest to implement, and that's to reduce your stress levels. Now, we all have stress, and that's a normal part of really being a human, and we can't take that away. But what we can do is make those stress levels more manageable. And there are lots of ways that we can do that. Cortisol is a hormone that is really popular right now. Another thing that is all over my Instagram feed, and I'm hearing a lot of people talk about cortisol. Cortisol is not new. It's always been our body's stress hormone, and it plays important roles. We want to have certain levels of cortisol to help our body function appropriately in high stakes settings. But we don't want that level to be high all the time because it can negatively affect our metabolic health and can lead to weight gain and increased blood sugar levels and other health complications. What do we do to actually lower cortisol levels, lower stress? There are certain things that are helpful for all of us, and then there's certain things that are helpful for the individual that can vary from person to person. Things that benefit all of us is physical activity, is exercise, and low impact exercise is great for this. So things like walking or yoga are excellent ways to release that cortisol levels and lower stress over time. Getting great sleep is so important. And this can be done in lots of different ways. And I want to dedicate a whole video to talk about sleep, but I will link below a